Okay, let's talk about several things that happen biochemically with fatty change, or the process which we call fatty metamorphosis, also happening chiefly in the liver. What happens during the process of fatty change? Well, one thing that happens is that when you have a catabolism of fat in your peripheral tissues is increased. In other words, it's broken down. And therefore, there's an increased delivery of free fatty acids to the liver. That's one mechanism. Another thing is you remember in the oxidation of alcohol at various levels in various parts of the cell, you have an increase in NADH. Well, that in itself also stimulates lipid biosynthesis. And if you have decreased oxidation of fatty acids in the mitochondria, that would also be a reason for increase in fat, wouldn't it? Last but not least, acetaldehyde, or if you remember that intermediate product between ethanol and the end stage in the mitochondria, it forms adducts with tubulin and therefore impairs function of the microtubules. And what happens when the microtubules are not functioning properly? Well, then there's decreased transport of lipoproteins from the liver. So these are all different things that are going to result in the same thing, increased of fat buildup within the liver. Now, it took me a long time to find this picture under my microscope, and I'm going to keep it because it is the world's best picture of the world's most normal liver histologically. You can see a portal area in which you have a portal vein, a small hepatic artery, perhaps a couple of bile ducts, and you could surrounded by fibrous tissue. And you can see a central vein, which is surrounded by nothing. And you can see beautiful, delicate liver cells and sinusoids and Kupffer cells. This is the normal histologist's dream of a perfectly normal liver. Well, look at this. Here's some perfectly normal adipose tissue. That's also from Histology 101. You don't even have to describe it. It's a pattern recognition thing. These adipocytes are loaded with fat, and therefore in the process of histology the fat washes out and all you see are basically the little cytoplasmic skeletal outlines of the cells, an occasional nucleus and some blood vessels. World's most perfectly normal fat. Well, let's go back to the liver and let me ask you this question. What would happen if you took world's most perfectly normal fat and put that in the world's most perfectly normal liver? You might get something like this, a fatty liver. This is a pattern recognition diagnosis. You don't have to go to high power. You can see this almost looks like adipose tissue, but we're actually seeing hepatic parenchyma. We're still seeing some residual portal triads, perhaps some central veins. This is classical fatty metamorphosis. And I also, as an exercise to my students sometimes, ask you this question. If this was a classical representative slice through any part of a fatty liver, I would then ask them, if the liver's normal weight is about 1,500 grams, and this particular liver is, let's say, 2,000 grams, I'm going to ask, what percentage of that liver is fat? And if in your mind you agree that about half of this cross-sectional area are washed out fatty spaces versus hepatic parenchyma, like you see here, then you would say about half. So if you took all the fat out of this liver, melted it, boiled it down, and the liver was 2,000 grams, which means it's a little bit enlarged, half of it would be fat. So far, so good. Here we are, higher power. You can see there is no necrosis of the hepatocytes. You have these big fat globules. Some of the lobules are within the cytoplasm of the hepatocytes, what they call microvesicular fat. Some of the fat globules are significantly bigger than a whole hepatocyte. That's macrovesicular steatosis. So sometimes they make that differentiation. And as you would guess, macrovesicular, which this is primarily, is more severe than just microvesicular, which you see here. Okay, let's go up the spectrum now. Let's say that you're looking at a fatty liver, but in addition, you start to see the appearance of inflammatory cells. And let's say you see like here, and maybe here, and possibly here some necrosis of liver sites. And here, and in addition, within these necrotic hepatocytes, you see these little granules. They're eosinophilic. You could see one here. You could see a good one here. You could see a good one here. These are the so-called alcoholic hyaline or Mallory bodies. And Mallory bodies are themselves made up of keratin filament proteins that have been ubiquinated or bound to other proteins. So this is not just fat anymore. Now we have a classical case of alcoholic hepatitis. But notice two things. Number one, you don't have any significant increase in collagen. And number two, you don't really see nodules at this level either. So a significant number of these, under the continued presence of alcoholic toxic changes, will progress to cirrhosis. And this is the world's most classical easy cirrhosis picture, because it has the two things that all cirrhosis has. It has these big bands of fibrous tissue between nodules. And folks, that's what cirrhosis is. It's regenerating nodules separated by bands of collagenous fibrous tissue. That is the definition of cirrhosis of any type. And of course, in the type of cirrhosis often attributed to alcohol, is often called nutritional cirrhosis or Laennec cirrhosis, or sometimes they'll use the term micronodular cirrhosis because the nodules are so small you can basically only see them under a microscope. They're very hard to see if you just cut the surface of the liver. They're definitely less than a millimeter. And this is classical alcoholic Laennec nutritional micronodular cirrhosis, consisting of nodules and bands of collagen separating the nodules. Okay, so much for the liver. Let's talk about the central nervous system toxic effects of alcohol. The classical syndrome of neurologic manifestation of alcoholism is something that's often called, as a combination term, Wernicke-Korsakoff. Even though basically they're two different syndromes, it also represents a spectrum. Wernicke is the less terrifying spectrum, end of the spectrum, and Korsakoff is the really bonkers one. In Wernicke syndrome, you basically have some eye symptoms like diplopia, ataxia, ophthalmoplegia. And if you look at the brains of these people, if they're autopsied, you'll see that the primary changes are in the mammillary bodies of the brain, as well as in the gray matter surrounding the cerebral aqueduct. And we're going to see a picture of that. Now, whether you're talking about the relatively more mild form of the disease called Wernicke syndrome, or the severe form in which the patient basically loses complete coherence, there's complete memory loss, confabulation. This is the more severe form of the disease. This is the form of the disease that you may not be able to improve by giving thiamine. In the lesser part of the spectrum, the Wernicke's, they can very well respond to prompt thiamine replacement. Okay, let's take a look at the brain in Wernicke syndrome. Do you see the cerebral aqueduct here in the midbrain? Do you see there's little hemorrhages around there? Well, that's a classical place for a pathologic change in Wernicke syndrome. Do you see the mammillary bodies here? Also some hemorrhage and necrosis. That's another classical thing. These are the classical anatomic pathology findings of Wernicke's disease. In Korsakoff, you may get these, plus they could be very easy, probably more severe, or probably a lot of other changes involving the more parts of the brain as well. What about the cardiovascular system? We talked about liver changes. We talked about thiamine deficiency causing Wernicke's and Korsakoff syndrome. You can have a wide variety of cerebellar degenerations or ataxias also associated with nutritional deficiencies, as well as neuropathies. So the alcoholic effects in the nervous system are chiefly due to reduced levels of thiamine and other nutritional deficiencies. Let's call it a day here because we're coming close to our 10-minute limit, and we'll continue with the next clip.